There are two exercises that I will demonstrate for you that are outlined in the boot camp programs for both spinal stenosis and persistent low back pain. These particular exercises are aimed at increasing the strength of the gluteal muscles and the erector spinae muscles without aggravating patient's symptoms. For the gluteal muscles, we'll have the patient on the bolster introducing flexion and at the same time activating the gluteal muscles. So she'll lift the leg a couple of inches from the floor and hold that position for 5 seconds, again activating the glutes, and then here activating the glutes on the opposite side. She's maintaining a flex position, which minimizes any closures of the openings of the spinal canals or aggravation of the facet joints. The other exercise is improving the strength of the erector spinae muscles, and in this particular exercise, the patient puts her hands behind her back. She elevates her torso just a couple of inches. Again, I've activated the erector spinae muscles, but maintaining a flex position. She'll hold that position initially for 5 seconds and increasing each week. And all the way down. Very good. So those are the two main exercises where the bolster can be useful in increasing strength of the erector spinae and gluteal muscles without aggravating patient symptoms. We're now going to demonstrate how the bolster can be used to alleviate symptoms when sitting and when sleeping or lying down. The Spinemobility Bolster can also be used to help people get a restful sleep, particularly those patients who suffer from back and back-related symptoms from spinal stenosis, the radicular form, or patients who have degenerative back pain or facet syndrome, or even far lateral disc herniations. The bolster, when resting the legs onto the bolster, puts flexion in the knees and the hips, which reduces the tension to the sciatic nerve and reduces tension and also pain. Also, the knees being bent and the hip being flexed reduces the lumbar lordosis, so the openings, the holes by which the nerves travel to the back and into the legs are larger, reducing pressure to the nerves and can provide with some relief. So this particular bolster can potentially give relief when sleeping. We'll now demonstrate how the bolster might help you reduce symptoms in your upper back, particularly patients who sit all day in front of a computer, or patients who drive all day, or have general achiness between the shoulder blades because of posture. I now will demonstrate for you how to use the Spinemobility Bolster to reduce pain and stiffness of the upper back. This is particularly useful for people who sit in front of a computer, who drive a lot, or even after a long day. The way this is performed is by putting the bolster on the floor and lying with the upper back lying against the bolster. What this does, it relaxes the muscles between the shoulder blades, also mobilizes the joints of the upper back. It also stretches the pectoralis muscle, which is responsible for you to stoop forward, which aggravates the upper back symptoms. This maneuver can be used throughout the day or after using the computer for long periods of time. Again, the bolster can be used very effectively for reducing tension and stress and pain between the shoulder blades. There are many people who have difficulty sitting for prolonged periods of time because of increasing lower back or leg pain. I'm going to demonstrate for you how you can use the Spinemobility Bolster to reduce symptoms of back and leg pain when sitting. The way we do this is by putting the bolster on the floor and putting the feet on top of the bolster. What does this do? Well, it does a couple of things. First, it reduces the curvature of the lower back. By reducing the curvature, you're increasing the size of the canals in the lumbar spine, which increases the space for the nerves going into the back and down into the legs. You're also reducing the tension on the nerves that are going down the leg because you're introducing flexion of the knees and the hips and introducing slack into the nerves, which reduces tension to the nerves going into the legs. So these maneuvers and these positions can help reduce pain when sitting and allowing you to sit for longer periods of time.